Hello, everyone. My name is Jeannie Guensha, and I am on the ADA's National Education Recognition Program Committee. And I'm really happy to be here today presenting this webinar. I am also an assistant professor at the University of Texas at El Paso Department of Public Health Sciences. I've had over 20 years of experiences in Hispanic diabetes disparities research, and currently I am the director of a diabetes education and self-management and support program for Hispanic men with diabetes. We know that Hispanic men have a higher diabetes rate compared to the national percentage. So because of this, we created a program called the Diabetes Garage. And in this program, we actually use automotive maintenance comparisons to engage men to participate in diabetes education programs and their own self-care. So essentially, there's a car culture within many Mexican American communities, and we really use this to engage men to want to participate in diabetes education. We know that women are more likely to engage in diabetes education compared to men. So with that said, I'm going to use some of my examples of my experiences with this program. For the most part, in this webinar, we will focus on how to go through the full DSMES cycle and address the 6 standards, particularly if you are working with a Hispanic or Latino community. And I use those words interchangeably, but recognizing that many communities can either or prefer to identify as Hispanic or Latino or Mexican American. So that's also part of knowing your Hispanic population. And we'll go through that as we go through the 6 standards. So the first standard for the DSMES cycle is support for DSMES services and really seeking leadership that's going to give you some really good information about how to engage and work with Hispanic Latino populations. And I think one of the most important things to consider when you're working with the Hispanic population is that it's really diverse. It's the largest growing ethnic minority population in the US. And so it's important to know that there's a lot of diversity and subcultures within the Hispanic or Latino population. And so it's very important to know how diverse your population is. And so to do that, I think seeking out leadership or people in the community who can help you understand that include the public health department. They can give you a lot of statistics on the distribution or the diversity of your Hispanic population in your community, your town, your city. They can, depending on what they capture and what they collect data-wise, they can give you the breakdown of education level, income level, where they live, maybe insurance, uninsured. They can provide a lot of information depending on what they get. So I think including folks from your Department of Public Health in your township or city is really important. They can give you a lot of really useful information about what your population looks like. Another really useful thing to include in your leadership, if you have a local university or research that's being conducted in your area, find out who's doing research with Hispanic or Latino populations. They will have a lot of really useful information. And maybe just work with them to see, how or what information they can give you, what support, what advice, as you start developing your DSMES services. I think reaching out to them first is really important, can be very useful. So reaching out to university researchers that work within Latino populations. Of course, your local businesses. You want to find out what businesses in your community have a large Hispanic employee workforce, and understanding hours, what's involved. And that's a really good way to enter an organization and see if you can work with them and their work schedules, because work is always something I feel that we experience that is the barrier, the challenge to get off and to make those classes or to participate online. So I think working with your local businesses and leaders in the community. And again, engaging the different religious sectors. There's a lot of different backgrounds in the different type of religious organizations that many Hispanic Latino populations engage with or participate in. So knowing those and reaching out to them, I think these are really good resources for you as you set up your DSMES service and getting to know the Hispanic Latino population and their needs in relation to diabetes. So I think those are my main recommendations as you work through the first standard for DSMES. So as we continue and discuss about the second standard, population and service assessments, given that I had just mentioned that the Hispanic Latino population is quite diverse, it's important to understand, the diversity and who you're working with. You want to know the economic profile, the educational profile of your population. And sometimes there's a lot of assumptions that there's a lot of lower literacy, which there are, but there's a lot of folks in the Hispanic population that have a really higher educational or income profile as well. So I think I'll give you some examples, and I think that's important to take into account. Of course, it's different in every town and every city. But through that and understanding what the needs are for those populations, and it's important. So for our population in particular, we're working with Hispanic, Mexican American men for the most part. And work is such an important part of their life. And so we really have to take that into account and adjust. And through COVID, we were able to go online, and we have found that that has met the needs of this male population in a way that we really didn't expect to. While we were having them show up in person, the online has really helped because they work so much. And so we've had men who have traveled, who have been able to participate on an online platform. So if you have that capacity to do online telemedicine, that is always helpful for a group that works a lot. We deliver our program in El Paso, San Antonio, and Harlingen. In El Paso, we have a pretty good distribution of income levels and education levels. And so we adjust for folks that want to do in-person or online, and we sometimes consider hybrid. We did that, but oftentimes it's online. And in Harlingen, we often see a lower income, so that is more in-person, making sure that our community health worker is there to help with completing any forms, and that group tends to work in the evenings as well. So understanding work schedules, and that's why I think working with employers as you're setting up your DSME is really important, given who your population is. For us, it's men, so understanding their work needs is really important. Just understanding diversity and the resources that are needed. And so, what challenges can happen? Definitely connectivity. If the broadband within a household is something to take into consideration, if you're online, that's something we experience. But we work with folks. So we do tech checks. So we make sure that they know how to work Zoom and know the technology before they actually participate in our program. But I think the first step is knowing your population and what their needs are. So for our example, it's work. Work seems to be very important. So creating a system that works for men. So we provide our workshops or DSMES in the evening to account for that. We had started out in the weekends, but what we learned is that men identified the weekend as family time. And so we realized that we didn't want to get into their family time. So we adjusted and found evenings, and we considered football. We actually looked at the days that football wasn't being offered or shown, I should say, and Tuesday was our best day because football is most nights. And so we wanted to take that into account. And so we actually went out of our way to look at the football schedule and have our courses, the classes, when there wasn't too much football. So those are just some of the examples for, how you meet the needs or challenges or delivery methods. So we were in person. Now we're online. We provide a handbook for the men. And so I think just knowing what the needs are for your population is important, and adjusting. So we try to adjust as much as we can. So with our population that we really wanted to focus in on are men with diabetes, and our program really uses automotive maintenance analogies just to engage them, because we know it's difficult, and for maybe folks who are not uh, do not have a lot of experience in the healthcare system, it may be difficult to communicate some health concerns if you're not quite aware. So we really, at each of the first workshops that we have, so, we cover the 7 areas of self-care, including physical activity, stress is definitely something we really focus in on. Medications, physical activity, is at that, complications, nutrition. We use different analogies. And the one I like to use for medications in particular, because I feel like that's where the men really pick up on, is definitely looking at medications as tools. And we have seen so many aha moments with our men where we have them realize that there are different medications that work on different parts of the body. You have different tools for the car that are only to be used on different parts of the car. And if you use them differently, they're not going to work. So we really highlight the importance of following the prescription for how they should be taking this medication, because if they don't use it correctly, it's not going to work. So when you identify that you should use the tool the way it was meant to be used, it'll work. The same with your medications. If you use the medication and understand where it works, that has been an eye-opener for a lot of our men. And so we really use that's an example of a delivery method that we use. So using comparisons to help them visualize their self-management is really important. And the other thing that we really highlight is we know that diabetes management is really difficult. And so we really use the analogy of it takes practice. So to be a good driver of your car, it takes practice to drive, right? You learn the skills and you practice and you become a better driver over time. You're always going to run into roadblocks. But the more you practice, the more you know the rules of the road, because we know there are rules to diabetes management, the better you're going to get. And so we really have them see management is not a one-shot deal. It's a process. And as you practice and you learn yourself and you learn your vehicle, is kind of what we talk about, the better you become at managing your diabetes. The more you drive, the more you learn your vehicle, the better driver you become. And so just those comparisons and the way you deliver, and I'm sure a lot of educators are really great about that, but finding that one niche for your population can make a huge difference. And I think we do always see those aha moments with men. So I think bringing in culture, and that's one thing I want to highlight, is that there are a lot of subcultures within a lot of different Latino, Hispanic populations. So again, knowing your specific population with regards to Hispanic background, Latino background is important. And even knowing why those two terms are used is important. So I think finding those niche cultures is a way to deliver messages that make sense to populations or your patients or your clients. So I just wanted to give those examples because I think for us, I have seen what a difference it makes. And so I think that's one highlight I want to bring up. So as we go over the standards, the next standards is your team. Who is in your DSMES team, and really how can you help provide resources to your team so that they can competently work with Hispanic, Latino populations. And I think, again, knowing your population is really important. And so I also want to highlight, what kind of continuing education would be really useful. And so your team, we know that there are many Spanish speakers in Hispanic and Latino populations. So having interpreters, translators, people that can do that for you as well. And again, going back to your universities, there are many universities that have programs where uh, it's a service to actually do some translation work. So if you need that, I think maintaining your communications with the universities is useful. And then there are other resources in your community as well. Oftentimes, community health workers can be a part of your team because they're also known as promotoras. They can have an understanding of your client and your patient's life and relate things to them in a way where they understand their lived experience. Um, so one of the common types of continuing education that can be used is cultural competency. And like I said, sometimes we sort of overgeneralize different cultures, and there's many subcultures. So there are a lot of cultural competency um, online trainings that can be completed. And the US Department of Health and Human Services actually has a really good website for this. It's Think Cultural Health. And they have different trainings for providers actually, and different lay professionals to complete. And this just has you get an understanding of what culture means, um, and allows you to think about the experiences that different cultures may have and to think about how you communicate with different groups. So it's not specific to one ethnic or racial group, but it's more of a how to have you think or be more aware about your approach as you work with different populations. So I always think those are really good trainings that they have. Um, Knowing your different foods and understanding the different foods within your Hispanic Latino populations is really important. Um, and knowing the history of foods can be also really useful in why we eat certain foods in different parts of, for example, I'll use Mexico. Um, the food in southern Mexico is very different from northern Mexico. So understanding those foods and how you can use them um, in your classes and when you talk about nutrition, I think is important to be aware that there are different and diverse foods that are eaten within the Hispanic populations. So trainings or CEUs on anything when it comes to foods eaten within Hispanic and Latin American cultures. Um, the one thing that I think is really important, and I don't think is looking at emotional well-being for your patients doing DSMES. Um, we oftentimes move to recommend behavior change, um, but in the pathway to health outcomes, I think emotional well-being sort of precedes behavior. And so if someone is not motivated or distracted because they're dealing with stressors in their life, or they may be feeling down, because of something traumatic, or a lot of times if you have lower income folks, there's a lot of chronic stress that they're experiencing and can easily be distracted. And that chronic stress also affects behavior. I know one example where this one woman would have to deal with family conflicts all the time, and she was in charge of helping her mom and dealing with sibling rivalry and conflicts, and she would forget to eat all day, and she wouldn't take her medications, and the PharmD that was working with her didn't understand. And so we talked about her life, and I was the interpreter for the pharmacist actually, and asking her when she started to see. So we actually just had her tell us her story. And I know lots of you do that. And we were able to pinpoint that in those moments when she was visiting her mom is when she was having her lows. And so she didn't even recognize that. And so through having that conversation about what's going on in your life, what kind of stress are you experiencing, we're able to pinpoint and target. And so she realized, oh my God, I'm having my lows because I'm not eating all day because I'm helping my mother. And so she was able to recognize that. So I think getting CEUs on emotions and diabetes is really important. And so the Behavioral Diabetes Institute out of San Diego has some trainings that I think are really useful in really understanding how not only the demands of diabetes, but the demands of life can really impact management and the behaviors that we really try to promote. So making sure that folks um, know how to emotionally regulate when you're stressed out so that they can focus on the behavior change. Um, and I think for the Hispanic Latino population, that's extremely important for everyone. I think it's important to look at emotional well-being for everyone with diabetes. Um, but there is a cultural belief, a historical indigenous belief within Latino populations that strong emotions causes or affects diabetes. And they were right, because now we know through research that there's a bidirectional relationship between stress and diabetes. So there was something within the Latino culture that they knew emotions were important. So I think because of that, I think also um, is a way to start a conversation, because a lot of times the behavior conversation can oftentimes come off as blaming, or they feel bad that they're not doing certain behaviors, and it can make folks feel a little like it's their fault. But when you start conversations with emotions about what's going on in your life, that can be impacting the way you're managing with diabetes. It takes away a little bit and gives them a little relief, like, okay, you're right, work has been affecting the way I manage, and so it's not this all self-blame sometimes. So it gives them a little permission, I believe. So emotional well-being and health is really important, I think, for your um, populations, and so getting any continuing education on that, I think, is useful. Okay, for standard 4, um, the services, delivery and design of services is really important. And so making sure that you use the curriculum to guide evidence-based content and delivery is important. Ensure the consistency of teaching concepts, methods, strategies with the team. So do you need to modify curriculum? Well, the most obvious is you may have to modify from English to Spanish, definitely. If you have lower literacy, numeracy, or health literacy populations, visuals are always important. Storyboards always work within lower literacy Hispanic populations. We have a diverse health literacy group in our Diabetes Garage program. And I think regardless, our comparisons of car maintenance, I think, work for a lot of folks. So, that's how we modified our curriculum, is to include those comparisons, particularly when it comes to the complications, your tires or your feet, your windshield is your eyes. And so we talk about cracks in your windshield and retinopathy in your eyes. And so making those visual comparisons are always something that are helpful. So if you want to modify your curriculum, use visuals, I think, is always important. I think another thing is when you talk about pharmacotherapies, oftentimes some Hispanic populations may find alternative venues for getting medication. So I think it's always important to ask where they're getting their medication from without judgment, and whether that medication is matching the prescription on the pill bottle. I have seen experiences when I worked with a PharmD, who was a CDE back then. The patient had filled the original prescription pill. So I believe it was 250 milligrams of metformin. And then we had found out that she was actually refilling through an alternative source. So she was getting her metformin not from the clinic, but she was getting 500 milligrams. So she would cut them in half and put them in the original 250 milligrams. So the language issue, I was the interpreter, became an issue where the pharmacist thought, because the pill was cut in half, that she was cutting the 250 milligrams in half. And so I had to explain to them that it was 500 milligrams where she was cutting in half. And so, um, making sure that you tell your clients and your patients, take off labels if you're not going to be following that label. Um, Keep the original container for medications so that the pharmacist or your healthcare professional or your educator knows what's going on. So I think understanding medication usage in your population is really important. And I just say that because it was it could have been necessary. I think there was thoughts of adjusting medication when it just needed to stay the way it was, but the communication was important. So again, that goes back to the need for interpreters who can help explain what was happening. So there can be a lot of confusion. And I think being open to alternative sorts of foods or supplements that are being used, and being very open and just having those honest conversations and not judging, but speaking about what can be useful and what may be harming, I think is really important. We know that nopal, cactus, a lot of Latino populations eat nopal. It's a high fiber content, so it really helps stabilize glucose levels. And so, I don't think there's anything wrong with that, but definitely knowing what supplements, alternative foods, or medication strategies are being used is important. So including that in your curriculum or having that discussion is really important. Having resources for folks who have challenges. On our Diabetes Garage website, we have a directory where we have resources for paying bills, paying for medications, understanding health insurance, which is always complicated no matter what, food assistance, housing, childcare, coping with stress. I'm a big advocate for addressing stress and diabetes management, dealing with relationship conflicts, substance use problems. We're really open about those things. And, quitting smoking. We have those resources on a website for our men in our program, and refer them there or work with other organizations. So provide a handbook or a list or a paper, anything you can with resources within the community is always helpful. So I think, and knowing who the support systems is always going to help in going through the whole cycle and making sure that you complete everything you need to for the DSMES service that you're providing. The fifth standard is patient-centered service, and making sure that DSMES is really focused on the needs and priorities of your population. And so working to be patient-centered, like I said, is really always knowing the challenges, the literacy levels, what are your needs and diversity of your population. Assessments, I think it's important to think about who the support teams are, and you can always get that checklist, that one family member that you can always contact. Sometimes there are some populations that move often or transient, and so having a contact that is pretty stable is one thing that can be useful for your folks. And then also just knowing the social and health context. I've worked in many communities where a Family Dollar or a general dollar store, I don't want to name specific ones, are their place to shop for groceries. So knowing the context of the environment can help understand what is available. So, how do you shop at one of the dollar stores, I will call them, so that you can meet, the balanced meals and make sure that you're not over indulging, or not even indulging, over an intake of processed foods, and making sure that you have a good variety. So even assessing that for yourself so that you know what they're dealing with is important. I've worked in many rural communities where the dollar store is the store. And so you have to take that into consideration, washing things out of the cans when you purchase them, just the small things that some folks may not think about. Definitely. Um, let's see. I think following the checklist that ADA provides you is so beneficial, and keeping your files organized in the folders. If they have this nice a diagram with how you keep your folders can help you complete that cycle, and just making sure you check off the things that you need. I think organization to help keep it that patient-centered DSMES is very helpful to go through that cycle. Communicate with your clients as much as you can, just to monitor and communicate and keep that open conversation as necessary as you go through their follow-ups. And then for the last standard, measuring and demonstrating outcomes of DSMES services that can help with a continuous quality improvement. So I think relationships are really important for all of us, but I think it's particularly important for the Hispanic Latino population. So any way that you can assess your relationship with your client or the patient is really important. There are a lot of really short surveys on provider relationship. You can look those up and, ask those simple questions. You can use 2 of the questions and, like, do they listen to me? Or are they asking me the right questions? I think those are useful assessments. So aside from the clinical measures that you're going to use and the behavioral outcomes, anything that can help you as monitor your service, I think for the Hispanic Latino population, definitely look at your relationship. So one thing we use actually an easy texting system where we text newsletters and we text messages to the men who have participated in our program. And we just try to always maintain that communication for feedback. And we have received feedback where some men actually have had some complication, and we just sent some cards out that said, heard you were getting some repairs done. We heard you were in the shop getting some repairs done. And just, letting them know that we're thinking of them and always wishing the best for their recoveries. So any sort of communication, we talk about bidirectional referral. We create a communication line where we have that bidirectional communication with our men. And so any way you can enhance your relationship with phone calls. I have a great program coordinator who's following up with our men, calls them, and so she'll let me know, what we need to pay attention to. And so having that team and recognizing that one person that can do that, I think is always a benefit for the program. And allows for completion of the program. And, we actually look at, how many men complete our program and how many men we need to follow up with. And it's always a work issue, but we have a pretty good retention with our men. And so I think just keeping them engaged is something that has been beneficial for us. So I think those are other measures outside of what's required to help with your service. And with the Hispanic Latino population, I think that's one thing that's important. So we've gone through the 6 standards, and I hope this has been beneficial for you and some of the examples that I have to think about that maybe you might have not have thought about. So again, the Hispanic Latino population is a diverse population, a growing population. So knowing the diversity and sort of the characteristics of the population you're servicing will only make your program better. And it'll help with all the other standards. I think getting that done in the first standard will definitely help your foundation as you lay out your service and move forward. And I really wish you the best as you go through your cycles for DSMES. I think more programs are needed. So anything we can do to help and assist you in setting the program up and understanding the different needs of different populations. Particularly for this webinar, we focused on the Hispanic population. we will continue to do so. And we really wish you the best in setting up your DSMES service and continue with fulfilling the cycle. So thank you so much for listening to the webinar, and the best to you all.